Let me know you're recording.
I'm recording.
All right, good morning, everybody. I'm Lowen, this is May. We have Nilo, Rubit, and Tal. And today we will be presenting to you our quality improvement project, which we have titled, We Don't Get the Flu, We Get the Flu Vaccine. So the objective of our quality improvement project today is to, 1, educate nurses and patients about the importance of the vaccination, 2, address the concerns that patients might have with vaccinations, and 3, hopefully provide an educational tool that will result in increased vaccination rates here at Valley Hospital. So identifying the problem. As nursing students, we all know how important flu vaccination rates or vaccines are to our own personal health. In fact, every year we're required to stay up to date with vaccinations for our safety while we're here in learning for nursing school. While we understand the preventative care and implications of the influenza vaccine, as nursing students, we recognize through observations during clinicals that the influenza vaccine distribution rates here are low. This is despite the fact that the hospital does practice asking patients upon admissions if they would like the vaccine during their stay. This then led us to create a survey to get a pulse of why patients are or are not getting the flu vaccine, look up some evidence-based practices, and present this information to try and improve vaccination rates with patients here at the hospital. So before going into the results of our survey, did you know that Healthy People 2020 has a goal to have 80% influenza rates in adults under 65 years old, and 90% for adults who are 65 years or older? This is one reason why we wanted to see how the hospital compared to that goal. So now talking about the results. So the survey that we administered, each nursing student had a preceptor, and that preceptor basically had about 6 patients. So of the total 30 patients that we could have surveyed, we were only able to survey about 24 of them. And here's our statistics. While we know that our sample size is small, it still proves some interesting insight. We were able to gather about 24 surveys, 16 of them who were men and 8 of them who were women. When it came to refusing the vaccine, we noticed that more men declined versus females. Less than half of the patients already had the flu shot, but for the people that didn't have the flu shot, almost 30% of them wanted it. So it was just a matter as simple of just offering it to them. Here are some more interesting facts. For patients that were less than 60 years old, 70% had or wanted the vaccine. But for patients who were 60 years old and older, only about 42% of them had or wanted the vaccine. This is really important because our research notes that the elderly is more vulnerable to infections and complications. And last but not least, like we stated earlier, more men refuse versus females. In our survey, we also wanted to find out why people didn't get the vaccine. So in this word cloud, you can see that the top 3 responses from the patients through our survey: 1, they don't ever get sick, so they don't need the vaccine. 2, another one is that they didn't want it because they got the flu shot before and then they ended up getting sick. And 3, the last concern from our survey was that people were unaware of what was in the flu shot or what the flu shot was, which is why they declined it or did not want it. We believe that what the patient response showed us is that there's a lack of education regarding the benefits of the influenza vaccination. This is where we as nurses can help bring
is included during dialysis or at their rehab center. So study shows that giving the flu shot is the most effective method of preventing the flu. So especially in older adults, when they are hospitalized and get the flu shot, their chances of getting the flu decreases by 71.1%. For adults older than 50, hospitalization, once they get the flu shot, their chances of getting the flu decreases by 76.8. So pneumococcal polysaccharide vaccine, 90% of annual deaths with underlying pneumonia pneumonia and flu are in people 65 years and older or older. Pneumonia infections rise and fall with the influenza season, so the best practice to deliver pneumococcal vaccine with influenza vaccine to decrease their chances of getting both.
Okay, vulnerable populations. So the elderly are one population that we are really concerned about, since influenza could result in long-term decline in major physical functions within the frail elderly population. So during the last 31 flu seasons, 90% of annual deaths from people older than 65 had underlying pneumonia or flu complications. One study did show that cardiovascular and lung patients showed a decline in hospitalization rates when they also received the flu vaccine. And other populations of interest includes diabetes patients, cardiovascular patients, and liver patients. Okay, effect of primary care providers. So several studies have linked low vaccination rate among healthcare providers as a contributing factor to influenza outbreaks. So one research that I want to share found one reason why there were low vaccination rates are related to low vaccination rates among healthcare providers themselves. So the study encourages healthcare providers to increase their education about importance and benefits of vaccination. They hope that with their own compliance, it'll help recommend, educate, and improve vaccination rates of their patients. We also did a quick survey of the staff members of our floor, which included nurses, EMS, CNAs, therapists, PAs, and physicians at one of our clinical days. And of the 32 that we asked, only one nurse said they did not get the flu vaccine just yet.
So next, we want to talk about some evidence-based practices that we found showed to improve vaccination rates. The first one was improvements with the use of the EHR or EMR. So by tracking, this showed that it helped by 99.9% with increase. Also, based on that same review, it was found that by incorporating the use of the EHR to identify clients eligible for vaccinations during their clinic visits, and upon accessing the patient's chart, this prompted either the medical assistant or the provider to actively choose to either hit accept or decline on the order for the flu shot. So this is telling us that by tracking the active choice intervention in the study, it was associated with a significant increase in the influenza vaccination rates over a period of time when compared to the control group. The EHR is not only trackable, but it's also a scalable approach for optimizing medical decision making and just simply improving vaccination rates in general.
Okay. Constant reminders that vaccination wasn't administered yet increased providers' confidence that opportunities would not be missed. So the electronic immunization screening assessment form encouraged continuity of care, and whoever completed the assessment would end up administering the vaccine. So electronic medical record use helped prevent previously missed opportunities, and the staff felt more confident in administering vaccines when they were the ones completing the screening tool at the admission. And those who actually refused the vaccine or already received the vaccine didn't count as missed opportunities, but instead they were indicated as failures if they were screened inappropriately or did not receive the vaccine.
So we did note that improvement rates were found in the people who had more frequent recommendations by their providers. If the provider is constantly telling the patient to obtain the vaccination, it's a way of promotion. So this kind of improves those rates. Also, there was an increase in coverage that was noted with people with increasing age, as well as increasing number of comorbidities. As this is related to having more frequent contacts with medical providers, therefore this creates more opportunities for vaccination. Next, we wanted to just show some comparisons between the studies that we found and what the hospital has here to offer. Something similar was that they both did utilize a screening assessment upon patient admission for the flu vaccine. but some of the items that we saw that were not provided here were that they don't include the pneumococcal vaccination along with influenza. There's no tracking of why patients are declining the flu vaccine. We didn't find an educational tool that was given. When we went and asked, we couldn't find anything. We didn't know that it was frequently offered to the patients during our time here. So we've created a tool in hopes to create more effective recommendations throughout the hospital here at Valley through some education.
So this is the pamphlet that we created to help with people a better understanding of the benefit of flu vaccine. So the first question we usually run into is, why is it important for me to get my flu shot? Flu is highly contagious and can be passed with cough or sneeze. It can cause symptoms such as sore throat, running nose, muscle or body ache, fatigue, vomiting, and diarrhea. Infants and older population can be more vulnerable and can cause death. Studies have shown a 71.8% decrease in hospitalization with flu by getting vaccinated. The second question is, I got my flu shot last year, so why do I need it again? Flu virus is very tricky and is always mutating, making our bodies not recognize it. Scientists use previous strains to predict what new virus will look like and reformulate vaccine based on the prediction. Another question is, can the flu shot make me sick? The answer is no. Flu shot has an inactive viral particle that cannot make you sick. It takes 2 to 3 weeks before vaccine can fully work. So within that time, if you will get infected with a light influenza virus or a cold virus, you may get sick. If everyone else gets vaccinated, do I still need to get vaccinated? Yes. In 2009, it was reported that 395,000 people died. Last year, 56,000 people died of flu. This number can be reduced by simply getting vaccinated. I'm healthy and I never get the flu, so I don't need to get vaccinated. You can carry the virus before showing symptoms, so you can spread the flu to others that are at high risk of contracting it. So protect yourself, your family, and those around you, and get vaccinated. Is it safe to get the flu vaccine when I'm pregnant? Yet it is safe to receive the flu shot and not the nasal spray because it contains live particles. The vaccine can protect you and your baby for several months after birth as well. I'm allergic to eggs. Does that mean I'm allergic to the flu vaccine? Yes, allergic reaction can happen, but they occur very rarely with the flu vaccine in the US today. A recent study found the rate of anaphylaxis after all vaccine is 1 per million vaccine doses given. Also, for people who don't like needles, there are also nasal spray vaccine. It is an alternative to the flu shot without needles. It's the same effectiveness with the flu shot and keep you healthy and through the sick season.
So through EMR tracking, frequent recommendations, and education,
we can help increase vaccination rates
and decrease complications and hospitalizations related to influenza,
thus improving the health outcomes for all of our patients.
And that would concluding our presentation. Thank you, everyone.
so at this time we would like to open up the floor for any type of questions or discussions that you guys might possibly have.
This pamphlet is really nice. You guys did a really, really good job on this. And I like that it's very simple to read because our patients' reading level it's like at a 5th grade reading level. So this is really, really nice. I'm gonna give it to the lady who's in charge of tracking the flu vaccination so she can have it.
We have that on a PDF file if that's easier versus like just Xerox copying that. We have that on a file that I could email one of you folks or maybe put it on a flash drive for you folks. That way it's just easier to make multiple copies.
I think this is really awesome. Thank you so much.
Thank you.